You must have just got it though. Okay, perfect. Well, welcome everyone. We're excited to have you here today, and we're going to be talking about first foods feeding infants and toddlers. And one of the reasons we're going to be doing this one today is it's actually the week of the young child. And so that's kind of how we got started on this series to talk a little bit more about young children. So we have something coming up each week for the next 4 weeks related to young children. So today we're going to do the first foods. Just a few things as we're getting started here. If you do need or want the captions, you can find the CC button at the bottom of the Zoom window. And then depending upon your device, you might need to hover over it a little bit and then it'll pop up. If you don't see that button, you can go over to the side and there's those 3 dots. You can click on that and find more. And then hopefully that'll get you to the spot where you can add the closed captions if you do want to hear that. And we are recording the video today, so we'll be able to have that available for you to watch afterwards. So we'll be sending a link out for that too. So my name is Mary Schroeder, and I'm an extension educator with the University of Minnesota Extension, and I'm also a registered dietitian, and I do quite a bit of my work in early childhood nutrition. So I'm excited to kind of share some new information with you today about first foods and some of the things that have changed. And I'm going to start by turning it over to Nikki, who's going to get us kicked off here.
Yes, hello everybody. I am Nikki Johnson. I am also an extension educator with the University of Minnesota, but I also split my time with North Dakota State University Extension. I too am a registered dietitian, and I am excited to talk to everybody today about feeding baby. We'll see if it lets me click. Okay, so kind of kicking us off. One reason I really love this topic in particular is because it seems like there's always new information coming out about what we should feed baby, when we should feed baby, and it changes fairly rapidly. I know, so my youngest is not so young anymore. She's already 11, but when she was first born, she the rules and the things, the guidance that they give us was a lot different than it is today. And so it's always good to do a little refresher about what's new with feeding baby. So as we kind of move through today's topics, there might be some information that you've known, it's sort of stayed the same, but we're hoping to touch on too maybe some of that information that's a little bit newer. So first up, we wanted to touch on vitamin D. So vitamin D has very much been a topic of conversation in the nutrition world for the last several years. But today, again, we're focusing on our infants. So what's so important about vitamin D in infant nutrition? Well, really, vitamin D is crucial for bone formation in babies. And it's not we don't necessarily get enough vitamin D in breast milk alone. So infants who are breastfed are definitely in need of supplementation of vitamin D. So any infant who is fed exclusively human milk, or maybe does a combination of both human milk and infant formula, is going to need a vitamin D supplement of 400 IUs per day. And that's going to really begin very soon after birth. Not something you need to wait on. We're going to start that supplementation kind of right away. And what that looks like, there are these little vitamin D liquid droplets that you would use to give baby, again, very, very quickly after birth. If an infant is formula fed, that formula is going to be fortified with vitamin D. So an infant that is formula fed really isn't going to need that additional supplementation, or at least not typically. The only time in which you would need to supplement an infant who is consuming mostly infant formula is if they aren't drinking at least 32 ounces of formula a day. Okay, if they're drinking less than that or consuming less than that, then we want to add those vitamin D supplements. So again, 400 IUs of vitamin D, you can get them in just some liquid drops, fairly simple, pretty easy to get your hands on. So next up is starting solids. So right around that 4 to 6 month age range, parents and caretakers really need to start thinking about introducing solid foods into baby's diet. And when you're thinking about introducing those solid foods, it is really important that baby is developmentally ready. So you might be wondering, okay, what does that exactly mean? Well, a baby should have control of their head and neck. They should also be able to sit unaided or at least with pretty minimal support. They should also open their mouth when food is being offered. They should be able to take that food in rather than spitting it out constantly. And in addition to that, baby should be able to, or should be trying to hold on to small objects and kind of be bringing them towards their mouth. If baby is checking all of these boxes, it means that they're probably ready to start those solids. So what does starting solids look like? And before I give all of the answers, Mary and I want to do a little knowledge test really quick. And we'd love for you to add into the chat here a response. What food should baby eat for their first solid? And we've got options here: rice cereal, wheat cereal, vegetables, or start with whatever you choose. What do you think the correct answer is? Mary, I thought we were going to trip them up. You guys are right. Most of you are hitting it on the head. The correct answer is D. Now, this is something that I would say is a little bit newer for me. So when Charlotte, again, Charlotte is 11 years old already. But when she was an infant, it was pretty much a given that when baby is starting new food, you're going to give them rice cereal. It was recommended that, baby start off with rice cereal, but that is no longer the case. Rather than that, we have kind of found that there isn't one specific food that needs to be given first, second, third, fourth. Rather, parents and caregivers are encouraged to introduce foods all across the food groups. So that's looking at your grains, your vegetables, fruit, protein, even dairy, but we'll touch more on that in a little bit. So again, there's no specific order to giving those foods. And I wanted to kind of touch back onto that 4 to 6 month age range. So that really is that sweet spot for introducing new foods. It is not recommended to start giving solids before month 4 because baby isn't developmentally ready. But they also say that they don't want you to start giving those solids after 6 months of age because those complementary foods, so the formula and the complementary foods, are necessary for that proper nutrition, as well as the importance of exposure to flavors and textures of new foods. So what does starting solids look like? Well, again, no specific order. But one thing you want to keep in mind is that you want to start baby off with single ingredient foods. And when you're doing that, they encourage you to wait 3 to 5 days before trying something new. And that allows you as the adult, the guardian, to observe any problems that might occur, such as food allergies. Something else to keep in mind as you're introducing those new foods is that it might take 8 to 10 different exposures for baby to really take to a new food. So be patient. Patience is required when you're starting off these new solids. Something else to keep in mind when you are choosing solids. So I mentioned single ingredient options to start off with, but you also want to choose very nutrient dense foods rather than filler foods. So that's going to be, again, foods that are going to be high in vitamins and minerals, and avoid things like foods with added sugars or beverages with added sugars, or even foods that are higher in sodium. We want to think about very nutritious whole foods for baby. A couple of nutrients to keep in mind as you're introducing these solid foods. Iron and zinc are really important nutrients that we want to consider when we are starting those solid foods. So iron-rich foods help to support neurological development as well as immune function. And so choosing iron-rich foods such as meats and seafood, or even iron-fortified infant cereals, are going to be a really nice complementary food to incorporate during those first few months of food intake, as well as zinc-rich complementary foods. And that's going to be things like meats, beans, again, infant-fortified cereals, because that zinc helps to support growth and immune function. Of course, as you are introducing all of these new foods, we always want to have an adult presence, making sure we're paying close attention to what baby is eating and how that process is going, just to keep them safe. But one other note with that is that when you are introducing solid foods, I know, again, the things that I used to think and the things I know now, right? They used to say, oh, if you want baby to sleep at night, just put a little bit of infant cereal in the bottle and it'll help them to sleep longer. That's actually not recommended at all. We don't want any solid foods or infant cereals added into baby's bottle. If you want to give them that infant cereal or any of those other foods completely separate from the bottle, just to keep choking hazards at a minimum. Something else I wanted to touch on, and you'll notice we have a change in pictures. So the pictures you've seen so far is little Miss Charlotte at, 6 months of age when she started her journey of solid foods. But featured here is my little nephew. This is little Clifford, but he is the first baby that I personally known who tested out this idea of baby-led weaning. So baby-led weaning is a type of feeding that's gaining some traction in the US, as well as just becoming more of an accepted idea. So I thought we should touch on it just a little bit as a way to talk about introducing solid foods. So essentially what baby-led weaning is, when you're introducing solids around month 6, right, is that baby is encouraged to self-feed. So you're kind of skipping that pureed spoon feeding process that often is a part of introducing solids, right? You've got your pureed peas, you've got your pureed pumpkin or your carrots or whatever it happens to be, and you're spoon feeding baby. Baby-led weaning kind of skips that, and instead they're giving appropriately sized food pieces, appropriately textured food pieces to baby, and they are really learning to just kind of feed themselves. I know when I first heard about this and my brother and sister-in-law were like, oh, Clifford's going to do this baby-led weaning. I was like a little bit nervous. We're giving these food pieces immediately. And so I was right away a little bit concerned about choking hazards. However, the research shows that this really hasn't been an increased risk in choking hazards. They haven't found that. So there hasn't been any adverse outcomes with this type of feeding process, so long as the parent or the guardians are choosing the appropriately textured shape and size of food items. Sometimes this process is also known as auto weaning. And what's kind of cool about baby-led weaning that I think a lot of people are attracted to is that babies is really incorporated into those family mealtime. That's not a separate, baby gets this and the rest of the family gets these foods. Baby is participating in that family mealtime. So they're at the table. And what's great about this is it's really encouraging baby to listen to their own body cues. So they're in charge of what they're eating, how much they're eating, and how quickly they're eating it. So they're really listening to those cues of hunger and satiety. Sorry, it does not want to click on for me here. Something else we wanted to touch on was potentially allergenic foods, because this is something else that has changed in the last several years. So it used to be that we thought by delaying the introduction of certain highly allergenic foods, we were going to be protecting a child from developing a food allergy. However, we know now that there is no evidence actually to support us delaying the introduction of those foods. So we want to start introducing potentially allergenic foods along with those other complementary foods. So I shouldn't say highly allergenic. Some of those potentially allergenic foods are going to be things like peanuts, eggs, tree nuts, shellfish, soy. And so they're saying we want to introduce those foods early on in baby's life. Again, always keeping in mind the size, the texture, those types of things. Of course, we're not giving nuts or seeds to baby, but instead it might be introducing a peanut containing food early in that first year. And speaking of peanuts, in fact, Introducing those peanut containing foods in the first year can actually reduce the risk that an infant will develop a food allergy to peanuts. So again, what we used to know is different than what we know now. We do want to introduce those potentially allergenic foods early on. One other thing to point out as far as choking hazard, since peanuts and peanut butter are choking hazards, if you were to want to introduce peanut, that peanut food, what a caregiver would want to do is to either find a peanut containing food item that's a non-choking hazard, or to thin out the peanut butter very significantly, either with a formula or breast milk, or even just mix a little bit into an applesauce so that it thins it out to the appropriate consistency. So what about other foods to avoid? I would say these have not changed, but it's still always a really, really good reminder to think about what foods we should be avoiding. So in infants, 12 months and younger, we still want to avoid any honey as well as any unpasteurized foods and beverages because they can contain harmful bacteria. And when thinking about honey, and this was something actually Mary and I talked a little bit about in the coming weeks to this presentation, when we think about avoiding honey, that also goes for any items that might contain honey, even if they're cooked. So I had to kind of wrap my brain around that. I was like, I wonder if, it was mixed into something and baked, if that would look any different. The recommendation is still to avoid any of those foods that contain honey. Which you might be thinking, hey, that might not be too hard to do, considering, again, when we're choosing those first foods for baby, we are looking at foods that are going to be really nutrient dense. We are going to be trying to avoid any foods that have those added sweeteners or added sodium. So maybe it's not as difficult to avoid, but just kind of keep in mind. And then the final item here that we want to stay away from in those first 12 months is giving baby any cow's milk. Giving baby cow's milk does put them at risk for several health complications, specifically related to their intestines as well as their kidneys. So we really want to hold off on giving cow's milk until babies' bodies are ready and equipped to handle the milk. Now, you may remember I mentioned when we're introducing those solids, I did say, hey, we do want to have a nice variety of different food groups, including dairy. So what does that look like? So again, we're avoiding the cow's milk, but you can give baby things like yogurt or cheese, or even a soy yogurt or cheese. It can be a great way to get, some calcium or even some vitamin D, but doesn't have the same ramifications as cow's milk would. So dairy group as a whole is off limits, just the cow's milk for now.
Thanks, Nikki. And we're getting some really good comments in the chats too. And one thing I'm going to follow up on is a question about putting rice cereal in the milk for reflux. And I know that I have seen that as a recommendation, but I do just want to check and make sure that that is kind of still recommended. I don't know if Nikki, if you know off the top of your head, otherwise we'll put it in the follow-up email. So we'll make sure we give you the most current, because again, it changes quickly. So we would, again, want to make sure we're doing the most current. So
yeah, and just a quick comment on that, Mary. It's really good to point out. So these recommendations are general recommendations. Sometimes there are some therapeutic ways we might feed baby that, a physician is going to recommend. So yeah, the bit on the reflux might be different than what we would tell everybody.
yeah. So, and also some regarding the baby-led weaning, some people shared that there's a good website called Solid Starts, which has some good information. So just passing that along too. So, so now we're going to talk a little bit about beverages after 1. Nikki did talk a little bit about the cow's milk, so we kind of got that taken care of. In terms of things that are new and I don't want to say new and trending, but kind of some things that are maybe more cutting edge is with breast milk. A lot of families are choosing to breastfeed past the age of 1, which is perfectly fine. One of the things that some parents have ran into is problems with breast milk in the toddler room if they go to a childcare center. And that is something that they can do, is to bring the breast milk into the toddler room. I would suggest that before your child does turn 1 or go into that toddler room, to talk to the facility ahead of time and kind of find out what their policies are, because some of them do have just internal policies saying they aren't going to allow breast milk in the toddler room because there's concern about it getting maybe mixed up with someone else's sippy cup. But it is okay to do. So, like if you start that ahead of time, you're not going to run into that barrier when like, oh, they're ready to start the toddler room and now we have a problem. So that'll give you time to kind of help work with them and kind of figure out how you're going to make this work if they currently don't allow breast milk in the toddler room. So just something to think of, and more toddler rooms are starting to do that. But if you happen to be the first parent asking that, you might have to kind of help guide that process through, but it is something that is very doable. Nikki talked about the cow's milk. So soy milk and plant-based beverages, these are nice alternatives for families after age 1, especially if the child is allergic to cow's milk, or if the family follows a vegetarian diet, or just a variety of other reasons why you might want to use a plant-based beverage. A few things to keep in mind if you are choosing to do a soy milk or another plant-based, such as your oat or your almond, and there's a couple other different kinds out there now too, is that you really want to make sure that you're looking at the food label, and you want to make sure it has protein and calcium comparable to what cow's milk does. Those are both important nutrients for a child. Actually, right now, WIC is only allowing soy milk as the alternative for their food packages. If a baby isn't able to have the cow's milk, they can purchase soy milk instead. That being said, a lot of the different plant-based milks are maybe adding additional calcium and some other things to their milk. So currently they're kind of looking at maybe redoing some of the WIC packaging. And that is one of the things that they are looking at. Are they going to be able to allow maybe a few more of these other plant-based beverages besides just the soy milk? But again, it's just really important to look at those labels and kind of look at the overall diet too, and see where they're getting the different foods and see what works best for your specific child. I put water on here. This is not anything new, but really just making sure that children have that option, that they are getting water between meals, and that it's not always, a sippy cup of milk that they're carrying around. Really encourage that water from an early age, because that is something that it's important that they get that water. And one of the reasons we want to encourage that water is because we still are seeing a lot of toddlers and even infants who are drinking too many sugar sweetened beverages. There was just a new research report that came out that said about 57% of children before the age of 5 are drinking sweetened beverages on a fairly regular basis. So that's definitely, added calories that they, even though a child's active, we don't want to introduce them that way. And also just for the dental health, if they're sipping on that sippy cup with those sugar beverages, it can really cause some problems with long-term decay. So we don't want to run into that. Okay. So now we're going to talk a little bit more about some vegetarian diets. So if you just want to put in your chat, true or false, a child under the age of 1 should not eat a vegetarian diet. True or false? So you can just put that into the chat. Okay. Seeing quite a few falses there. Few truths. We do have a good group. We thought we'd maybe have a couple that we might be able to stump people on, but that's not quite the case. So that is false. It is fine for a child to follow a vegetarian diet. And this is one place where I see a little bit of discrepancy with maybe the parent versus the grandparent, because grandparents sometimes didn't grow up as much with a vegetarian diet or a meal plan. So they get quite concerned that their baby or grandchild isn't going to get the nutrient that it needs. So this is a place where parents can just kind of reassure, and other people too, that a vegetarian diet is fine for an infant and toddler, but there are still a few things you want to keep in mind. If the baby is following a lacto-ovo vegetarian diet, it's much easier for them to get the protein and the calcium that they need, and that's because they include the dairy and the eggs if they follow a lacto-ovo vegetarian diet. So that makes it a little bit easier. Where you need to really pay closer attention and probably actually work with your healthcare provider a little bit more is if you follow a vegan diet, and they're not going to get any animal products whatsoever. So no fish, no dairy, no eggs. Those are ones where then we start to kind of look at a couple nutrients of concern. They might be a little bit low in iron and B12. And these are both needed for brain development. So it's important that they are getting those nutrients when they are young. So if you want your child to follow a vegan diet, again, it's very doable, but just talk to your healthcare provider first and maybe see what you're currently eating, maybe do some blood tests too and see where their hemoglobin is at. And then you can determine if a supplementation would be needed. So again, just nice to know that it is something you can do, but just kind of make sure that you are including the right foods and then supplement if you do need to. Just wanted to address food safety a little bit because that is important. We have these young children and their immune systems aren't really in full gear yet. So it's important that we're really practicing some good food safety with infants and toddlers, really making sure that you're washing hands well and you're keeping all your bottles and breast milk pump pieces, those are all clean. That's important to do. And also that you're following the recommendations in terms of how you store the milk. So right now they're recommending to refrigerate breast milk within 4 hours, and you can keep it for up to 4 days in the refrigerator. And then if you do freeze the milk, you can thaw it out, but just make sure that you don't refreeze it again. And then whether you're using breast milk or infant formula, once you feed that to the baby, then you may put it in very quickly for the refrigerator, but basically if you don't use it, you need to discard it because there's just too much opportunity for that bacteria to grow within the bottle, and that could make the baby sick. And we definitely don't want sick little babies and toddlers out there. The last thing I just kind of wanted to mention is with the high cost of food, it can be even more challenging for a young family if all of a sudden they have another mouth that they need to feed. So I just wanted to mention there's a couple of resources out there for families. We have the SNAP Food Assistance Program, and then the WIC program, the Women, Infant, and Children program. And this one's especially important because they really do recognize it's important to get young children and pregnant women the nutrients they need to really get everybody off to a good start in growth and development. So it's a wonderful program. And the one thing I know, we're really talking about infants and children here or toddlers, but a lot of times after they get past that toddler age, a lot of people quit participating in WIC, but you can still participate in WIC up to age 5. So really encouraging people to stay with it as long as you can because it's a great way to supplement your food budget. So that's important. If you don't qualify for WIC, there's still some wonderful WIC resources that are out there available online. I like to say this is a really good place you can go to get the latest information. Or if you are like following some of these newer recommendations and you have family members who are saying, oh, you need to start with rice cereal, really you do. It's a good place to go to get some of that really reliable information to say, nope, this is what the Minnesota Department of Health through their WIC website is recommending. We know this is why we are doing this. So that is a really nice resource for families. Okay, so just in wrap up today, we'd like you kind of to share one thing that you learned today. And if there's one action that you plan to take today, and here again, we have little Charlotte just as a little newborn, and now she's much older. But again, we're always seeing things change and we get new information, which is always really good. A few things as we're finishing up here. If you'd like a certificate of participation, we have a evaluation that we'd like you to fill out, and then we will make sure that we get that to you. I'll put the link to the evaluation. Oh, and Sarah is on top of it. She's our overall coordinator and she beat me putting the link in there. So just fill that out and then we will make sure we get that to you for the evaluation. Let's see. And we have a few more additional webinars coming up. These are January through April webinars. We're getting towards the end of the April ones, and Sarah is our lead coordinator for these, and she's already planning our webinars that'll be starting again in May. So if you're interested in those additional webinars, you can always check this website. We have the QR code here, and then you can find out the new and exciting ones that we have coming up. And again, each Wednesday during the month of April, we're featuring a different one for young children. Next week, we're doing foods for preschoolers and kind of how to deal with those picky eaters. We also have games and physical activity the next week. And then the final week, we're going to talk a little bit more about cooking with kids in the kitchen. Okay, here's some additional ways that you continue to engage with us with our Facebook and Twitter and some of those different accounts, depending upon what you have. And finally, we have a few photo credits for you. And we really have to thank Nikki for all the wonderful pictures. I told her, I said, you got lots of photo credits today of your family. So it's really nice that you could share those. So let's see, Nikki, did you notice, was there anything in the chat that you wanted to talk about that people put in here?
I was just typing some things.
Okay.
There was a question about like 0-calorie sweetened beverages or even waters for, I think that's how you say it, for children after the age of 1. And what kind of effect that has. I can't, and I was just kind of replying. I said, I don't know a whole lot about waters, but as far as other beverages go, after the age of 1, Really thinking about those younger years though, we still really are focused on nutrient dense beverages as well as foods. So thinking about milk, minimal juice, and looking for 100% fruit juice when we are giving juices, again, smaller quantities, simply because children that age aren't eating as much, right? So we want to make sure
Mhm.
the nutrition that they're, or the food that they're eating is very nutritious. So I would say typically kind of focusing on, milk, and whole fruit juice or even water is going to be the best option over anything else. I don't know if you want to touch on that too, Mary.
No, I would agree with everything you just said. And the cost wise too, again, those beverages are getting more and more expensive. So if you can stick to the water between meals, it's going to be way less expensive than buying some of those other beverages that some of them can get pretty spendy. So, but that does also make me think that if you are doing the water and you live in a rural area, or if you buy bottled water, you need to make sure that you're getting water that either has fluoride added to it or that you're using the fluoride supplement. So I had some nieces and nephews and they used bottled water at home and they had a lot of problems with dental caries because it didn't have that fluoride in it. So just made me think of that to throw in there too. So well, these were just kind of a brief these were just actually half-hour webinars. So just to give you a quick introduction. So we're kind of at the half hour already. So I'd like to thank everyone for joining us today. If you have any questions you want to stay on and ask, feel free to do that. Otherwise, make sure you fill out that evaluation and then you can get your certificate of participation for that. So thank you all for joining us today.